As Lung Cancer Awareness Month begins, it's crucial to spotlight the global impact of lung cancer, which affects 2.5 million people each year and is responsible for 1.8 million deaths annually. While smoking remains the primary risk factor, exposure to pollutants, radon, asbestos, and infections like TB also contribute to this deadly disease. Prevention through smoking cessation and avoiding harmful exposures is key. However, early detection is equally important, yet only 5% of those at risk receive lung cancer screenings, compared to 90% of women who undergo mammograms. Dr. Satish Kathula, hematologist and oncologist, emphasizes that annual low-dose CT scans for eligible smokers can significantly improve survival rates.
Hello, my name is Dr. Satish Kathula. I'm an oncologist and I treat lung cancer patients. I am the current president of American Association of Physicians of Indian Origin. November is a lung cancer awareness month. Lung cancer is the most common type of cancer. Also, it is the most common cause of cancer death. And about 2.5 million cases are diagnosed every year in the world, and 1.8 million die from lung cancer every year in the world. And it's one of the most preventable cancers. So what are the risk factors for lung cancer? Smoking is by far the biggest risk factor. 80 to 90% of lung cancer patients are smokers. And there are other risk factors such as exposure to pollution, exposure to radon in the basements, exposure to asbestos, and certain infections like TB, HIV, Epstein-Barr virus, and autoimmune diseases can all increase the risk of lung cancer. So how do we prevent them? Quitting smoking if somebody is smoking. Number two, getting radon checked in the basements and getting it exhausted from the basements. And also having screening done. If somebody has significant smoking history, they have to get screening done with a low-dose CAT scan of the chest every year. It starts when somebody is 50 and it goes on until 77 or 80 years of age. So it is very important for the smokers to get this screening test done to detect early stage of the cancer so that we can cure it. For example, with women who are getting mammograms to detect early stage breast cancer, the uptake rate is about 90% for mammograms, as opposed to the lung cancer screening, which is severely falling behind. Only 5% of eligible individuals get screening tests done for lung cancer. So it is very important to be aware of that. If somebody has a significant smoking history, they have to quit smoking, number one. They have to get the screening CAT scan done every year. So that's the message I want to give in the month of November. So thank you.